as local hospitals take steps to make sure they can handle this growing number of coronavirus patients, they're still looking for clarification on a key announcement made yesterday, the state's mandate to halt elective surgeries in Erie County. That story from Dave McKinley.
As the number of cases go up, the governor is convinced of one thing.
The number one priority when you get into this situation, hospitalization and overwhelming the hospitals.
Local healthcare systems say they're nowhere near that point and already had taken some of the steps the governor had outlined to prevent that from happening on their own. But they still don't know whether his mandate to end elective surgeries in Erie County as of Friday applies to just those done in hospitals, requiring a patient to stay for a bit, or if it applies to ambulatory centers and freestanding facilities outside of hospitals that do outpatient surgeries. They'd like to continue doing what they can, or at least tell their patients and medical staff if they can't. But more than a day after the governor's mandate, they still don't have a clear answer, and we have been trying for just as long to get some clarification from the state health department, but that too has been fruitless. Coming up later, why healthcare providers say that the idea that ending elective surgeries will suddenly free up a whole bunch of new staff to treat COVID patients is somewhat of a myth. Dave McKinley, Channel 2 News.